Hello and welcome back to GP Video Podcast by Nadia. So I know that we are talking about attention deficit hyperactivity disorder at this stage. That's the topic that we are carrying forward along with some other topics. And we spoke about the pharmacological treatment this morning about it. But then I would like to open another topic because otherwise if I just keep on dragging the same topic, that might become a bit boring. So the topic that I'm going to touch upon today is called long COVID. It is again a very, very important topic, and I would like to share my information with you guys as much as I can, and we'll make a few video podcasts on it and we'll see how it goes. So today's topic is long COVID. So when we talk about the definition of long COVID, there are so many opposing thoughts about it, but the Medscape CME and education slides that I've got for it, I would like to read that. So of course, number one criteria is that you should have history of COVID infection, and if possible also proven by a serology test, because there are two kinds of serology tests that you can do for COVID. One serology test will show whether you have been infected in the past or not, and the other one will show that whether you have been vaccinated or not. So there are so many people who still haven't got COVID, and they can prove that by doing both the serologies, in which if they are vaccinated, their vaccination serology would be positive, but their infection serology would be negative. So in these cases where we want to come up with a diagnosis of long COVID, the serology of infection should be positive. Okay, so history. Then number two, symptoms usually last for more than 2 months. Okay, so symptoms usually last for more than 2 months. But what can happen is you can have acute COVID, all symptoms resolved, everything done, everything gone, and then the symptoms can reappear. Symptoms can have new onset, can persist. Either they can persist, so you had acute COVID, after that they have just persisted for more than 2 months, or they can go away and come back within a few days or within a week or so, can fluctuate and relapse. So all these kinds of symptoms, all these kinds of onset. Symptoms can have new onset, persist, fluctuate and relapse. But you should have history of acute COVID, which should be proven by the serological evidence, the antibodies against the COVID virus, okay? And then symptoms cannot be explained by any alternative diagnosis. So again, a diagnosis of exclusion, in which we have to rule out all the other tests with all the other causes with the blood tests, with probably if needed scans, with urine tests, and all the other tests that GP would like to do to diagnose or exclude other causes. And after that, we can come to the conclusion of long COVID. And symptoms can impact everyday functioning. Symptoms can impact everyday functioning. And common symptoms, the commonest symptoms of long COVID are fatigue, shortness of breath, and cognitive dysfunction. Fatigue, lethargy, having no energy, shortness of breath, and cognitive dysfunction like memory issues, and behavior issues maybe, and cognitive dysfunction. What are the other terms that are used for long COVID? Post-COVID conditions, long-haul COVID, post-acute COVID-19, long-term effects of COVID, chronic COVID. Past infection is used to refer to a subset of long COVID. So these are all the names that are used for long COVID. So again, we know what are the most important symptoms: fatigue, shortness of breath, and cognitive dysfunction. Symptoms usually lasting for more than 2 months. And that will be most probably called as a diagnosis of exclusion and long COVID. So what are the other definitions? Acute COVID-19 is signs and symptoms of COVID-19 lasting up to 4 weeks, while ongoing symptomatic COVID-19 is signs and symptoms of COVID-19 lasting from 4 weeks up to 12 weeks. And then after that, it would be termed more than 12 weeks, which is usually between 2 to 3 months. So if we talk about 12 weeks, every month almost has 4 weeks, so 28 to 30 days. So anything lasting for more than 2 months less than 3 and more than 2. Anything for more than 12 weeks is then called long COVID. Okay. So post COVID-19 syndrome or long COVID, signs and symptoms that develop during or after an infection consistent with COVID-19 continue for more than 12 weeks. Please remember 12 weeks. If we don't want to go in the months thing, we'll just say 12 weeks, more than 12 weeks. So between 2 to 3 months. Not explained by an alternative diagnosis. The blood tests, the scans and everything do not show us anything else. Usually a cluster of symptoms, often overlapping, and symptoms can fluctuate and change over time and can affect any system of the body. So it doesn't have to be the respiratory tract only. It can be gastrointestinal, it can be neurological, it can be cardiac, it could be anything. Multiple systems at one time or one system at a time, it could be anything. And symptoms can go away, come back, relapse, have a new onset, all that kind of symptoms. So the actual COVID lasting anywhere between 1 to 4 weeks, and then after that symptoms might go away and then come back within a week or so, and then have a new onset, relapse, fluctuate, and anything then lasting more than 12 weeks is then termed as long COVID. Okay, and then as I said, the symptoms are, so it's a spectrum of physical, social, and psychological symptoms, functional limitations that can present challenges to patient wellness and quality of life, impacting day-to-day quality of life. Important to listen to and believe patient description of symptoms and rule out non-long COVID causes. Management should include supportive care for symptoms and psychosocial support. So what are the commonly reported symptoms? Again, breathlessness, fatigue, cognitive impairment or brain fog, not remembering things, what you are doing, cough, chest pain, headache, palpitations and tachycardia, joint pain, muscle pain, altered sensation, paresthesia, pins and needles, abdominal pain, diarrhea, insomnia and other sleep difficulties, fever, lightheadedness, impaired daily function and mobility, pain, rash, mood changes, menstrual cycle irregularities, erectile dysfunction. So all of these symptoms, 1 or 2 of them, 10 of them, 5 of them, a cluster of them impacting day-to-day life. We'll come back to this topic tomorrow.